Okay, welcome back. We have with us this morning one of my favorite people, Sarah Heenan, the Executive Director of the Heart Center at Nash UNC.
Yes.
And so glad to have you. You know, something's coming up that I'm really passionate about. Went to it 3 years ago?
Yes.
3 years ago. Of course, old COVID, you know what happened. So they're having the Healthy Heart Fair.
We are very excited. We've missed it for 2 years.
Yes.
Because obviously nobody could gather together,
Right.
but
That's
we are
right.
having it June 2nd from 4 to 7 at the Nash Heart Center.
Yes.
We are going to have, I think, 8 stations. We're going to be doing lipid testing. We're going to be checking your blood pressure. You can talk to some heart failure specialists.
Wow.
We are raffling off a watch.
Wow.
Yeah, so an
That's
Apple Watch, so
exciting.
you can join the raffle for that. You can tour the Heart Center. You can talk to a dietitian. We're doing hands-only CPR training, which is very important for the community, and we really look forward to getting out there again.
Well, you know, Sarah, is it true that some of these people that will come through there and get their blood pressure taken and things like that, maybe their lipid test, maybe this is something they don't otherwise get?
That's correct.
Is that true?
Every year that we've had the fair, we have found at least one person that we've had to send to the emergency department.
Wow.
Because their blood pressure was so high that, and they didn't even know. You know, they had no idea.
Yeah.
So this is our way of providing services to this community where they may not have access. And so we want everybody to come. We want to take care of as many people as we can possibly take care of.
So it's June 2nd.
June 2nd. From 4 to 7. We've been having it on Saturday mornings previously, and we're doing it from 4 to 7, hoping that you can stop by after
Yes.
work. It's convenient on the way home. We have snacks we're going to have there.
Right.
We're just trying to make it more accessible to as many people as possible.
Well, I think that's a good time because this time of year, people on Saturdays might go to the beach.
They might be
or
busy,
out of
right?
town.
They're on vacation.
I think that's a great time to have it.
Yeah,
And
we
so-
usually do it in February. February is Heart Month.
Yeah, that's true.
But we had a surge in February, as you know.
Yes.
And so we just put it off. We were planning on doing it in February and put it off till June.
Yeah.
So that's why it's in June, and we were thinking that's the same thing, that
Right.
people will be on vacation, people have things to do on Saturdays,
Right.
might not want to stop by the Heart Center, so this would just be a more convenient time for them.
Absolutely. And it's so nicely structured. You go from booth to booth and lots of information. You pass out lots of
We do.
healthy information and healthy tips. What kind of healthy tips can you offer, Sarah, to people?
It's really back to the basics. It's eating less fat, it's exercising, even I tell my patients that they say, I can't exercise, I'm not able to. Well, you can walk to the mailbox.
Right.
And then the next time you can
That's
walk a
better
little
than
bit
nothing.
further. Right.
Right.
Obviously not smoking, that's a
Yes.
big one down in
Yes.
this area. Just eating more healthy food, that kind of thing, reducing your salt,
Yes.
getting your blood pressure checked. There's lots of places in the community where you can get your blood pressure checked. A lot of drugstores have blood pressure check, machines and that kind of thing, and taking your medications. And telling us if you can't access your medications, if you have a problem getting medications. A lot of people in this area don't have the resources to do that. But the hospital has places where we can plug you in
Yes.
and get what you need. You just have to tell us.
Exactly. Well, I took the tour. I've taken the tour several times, but last
you have.
time, yes. And I love going in there because, the equipment, and I heard this on one of our health shows. One of your folks had talked about this. So people from Chapel Hill have made comments. Doctors, a couple of doctors from Chapel Hill have made comments about the equipment that Rocky Mount has
Yes.
in our Heart Center.
In our Heart Center, yes. The platform that we installed when we opened the Heart Center was the first installation in the United States. So we had better equipment than anybody in the entire United States.
Isn't that amazing?
And it's a testimony to the administration because, when they said, let's build a Heart Center, and I brought them a book that was about 6 inches thick, this is what I need.
Yes.
And we got it. And the reason the story of the Heart Center, of course, begins a long time ago in a trailer behind the hospital.
Right.
That's where we first did diagnostic work. But the goal has always been to bring this technology to this community.
Yes.
Because if you look at our community, we're an hour away from any major hospital.
Right.
So people would come to us and they'd be in trouble. They're having chest pain, maybe they're having a heart attack, but there was very little we could offer them besides transfer.
Right.
And now when they come, we can take care of them.
You can do stents.
We can do stents, we do pacemakers, we do ICDs now. I mean, there's very few community hospitals that provide the services that we provide at Nash Healthcare.
Wow.
And I'm very proud of that.
Yeah,
right?
I guess so.
Yeah, people were dying.
Yes.
Before this, and so now when we come, it's kind of funny. We have a subset of population that's traveling to Florida.
Right.
So we had this lady that was traveling back home, and she just came last week, and she was having a heart attack, and we took care of her.
Wow.
And she went back to Maryland in 2 days, and she wrote Dr. Espinoza the nicest note. She says, I can't imagine what it feels like to save a life. And so I have a pretty gratifying job.
You
I do.
do.
I do.
You
I really
really do.
Yeah.
So, how many heart attack patients do you service in a year?
So we started taking care of heart attack patients in 2016. So the number's been fairly constant. It's been between 60 and 70 a year.
Wow.
However, this year we're probably going to take care of about 100. So we definitely have seen an increase in the number of heart attack patients that we're taking care of.
Wow.
It's been a very busy year.
It has been, but y'all do take care of them, and that's
Absolutely.
the important thing.
Yep.
So back to the Healthy Heart Fair. Please go to the Healthy Heart Fair. You won't regret it. It is a wonderful thing. You learn a lot, and again, you get your blood pressure checked, your lipid test, all of these great things. And I think also the physical therapy department.
So it's the cardiac rehab department.
I'm sorry, it sure is. The cardiac rehab is there to talk to you,
Right.
and you
talk to you
they're
about
gonna do that again
exercising.
this year.
Yep. Going to bring the machines. I got on the machines last time we did it, and I had a race with one of the people that came to the fair, and he won. So I was he was in good shape. Yep. So
Well-
that'll be there also. Yep.
So make sure you go June the 2nd from 4 to 7. So when you get off work, just head over for a little while and walk through. Like I said, please take the tour. You won't regret it. So you can see our Heart Center and visit all the booths, because you can gain so much valuable information at each one. So even, they'll talk to you, as you said, about weight loss and things like that, all kinds of healthy things that we absolutely need. So, Sarah, thank you for being on.
I always enjoy coming on. Thank you for having me.
Always a pleasure, Sarah. All right, we'll be right back on the Don Bullock Chevrolet Morning Show right after this.